Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Colonoscopies certainly aren't everyone's favorite procedure, but the screening process is important. We recently spoke with Dr. Nam Pledji with the Division of Gastroenterology about preparing for a colonoscopy.
So historically, what we have done is have people drink a large volume solution to clean out their colon prior to the colonoscopy. What we've learned over the years is that diet is very important to this. So although the majority of the prep occurs the night before, the process should begin about a week prior. And there need to be changes in your medication sometimes, changes in your diet, that then make the last bit of the procedure, which is drinking the actual preparation, much easier. Traditionally, people drank a gallon of solution and then many glasses of water in addition to that. What we found is that there are other preps that can be given that are much low volume. In comparison to that, we now have a prep that's 2 5-ounce cups that you have to drink 5 glasses of 8 ounces of water with, but again, a very small volume. And our professional societies have recommended that the prep be split over 2 days because it's better that way. The prep is better and it's far less uncomfortable for the patient. So the first part of the prep is taken the day before, as we did traditionally, and the second part is taken very early in the morning before the colonoscopy.
Why are patients more concerned about the prep than the procedure?
One is that it's a large volume. It's very hard to drink a large volume of fluid, even if it tastes well. The solutions in general, although they're flavored, are very salty tasting, and so they're not the most palatable thing to drink. And so many patients, especially those who've done it before, have trouble with it. It's hard to drink a gallon of something you like all at once. And if it's not pleasant, then it's much more difficult. And I think that's the thing they're frightened about. And they're afraid that what the prep does, which is cause diarrhea, will make them uncomfortable as well.
Have there been any changes or improvements to the preparation process?
Start a week in advance, read all the instructions, and the instructions tell you that a week before, if you're on certain medications, there need to be changes, and that about 3 days before you need to modify your diet. So we want you to decrease high fiber foods and other foods that are going to be more difficult to digest, and foods that will stay in your system longer and therefore make the prep more difficult. So that's an important change that we've made.
Why is the preparation so important for an effective colonoscopy?
Because we want the colonoscopy to be a good examination of the bowel, and the prep determines that. Every year, about 50,000 people die from colon cancer, and 150,000 people are diagnosed with colon cancer. Almost all of this is preventable. And the way we prevent that is by doing the colonoscopy and removing these polyps before they become a problem. And the prep has to be good so we can see the polyps when we do the colonoscopy.
How do you help patients overcome their fear of the preparation so they can get a colonoscopy?
The best thing to say is what patients say to me. They say afterwards, the most common question they ask me is, when are we going to start? So it's generally a lot more comfortable than they think. We also have options in terms of the medicines we give them to make them comfortable. That's changed dramatically over the last 2 years. So that some patients receive what we call monitored anesthesia, which is they are totally asleep like they would be for surgery when they have the procedure. Other patients get the traditional sedation, which again, we can use a combination of drugs to make them very comfortable, and under both circumstances, things are very safe. With the monitored anesthesia procedure, we have anesthesiologists present there to monitor everything while we do the colonoscopy. Sure. The recovery really is based on what type of anesthesia or sedation they receive. With the monitored anesthesia, it's very quick because the drugs are very short acting. So they wake up almost immediately. And although we suggest that they not drive or sign contracts or do things, some things that they would normally do for about 24 hours, they function almost completely back to normal immediately. For the patients who get the moderate sedation, those drugs are a little longer acting, and so they may be a little bit drowsy for a while afterwards, and that may take a little bit longer. But in general, you're able to get up and leave and go home within 30 minutes of the procedure. The prep is really the most difficult part of the procedure. The procedure itself lasts anywhere from 20 to 40 minutes on average, and patients generally aren't aware that they're having the procedure.